Good morning. I'm going to start calling these makeup moments. I want to talk to you about something because I think when I talk about hormones and breast cancer or hormones and a history of cancer, people really have a lot of feelings, and that's fine. But I think I'm going to tell you a story, and I think it illustrates my point on that group of patients in a better way, in a way maybe that we can understand without having huge feelings. So this is not the first time this has happened, but on a number of occasions within the last couple of months, I have been contacted by a family of a patient with Parkinson's disease. Now, I'm going to tell you the story of one of these. So this patient, she has Parkinson's disease, and she and her family contacted me because they wanted to talk to me about treatment options and modalities that were not available to them conventionally. So they came and saw me, and what they really wanted to talk to me about was GLP-1s and the fact that there are some studies that have been published and some evidence suggesting improvement in both cognitive and motor skills in patients with Parkinson's disease with the use of GLP-1s. Now, these are very small studies, and it's very in its infancy, but it's certainly, very encouraging. But they wanted to talk to me about it because they wanted me to start this patient on a GLP. Now, there are a number of risks associated with that, especially in a Parkinson's disease patient, particularly constipation and bowel habits. That's a major issue in patients with constipation, with Parkinson's disease already. Also, weight loss. We don't want patients with Parkinson's disease losing weight. So there are, therefore a number of risks of using a GLP. But her position was, well, I understand the risks and I still want to do it. And I said, well, why don't we wait for a little bit more information to come out? Perhaps there's going to be a change. And she said, I'll be dead by then. I don't want to wait. I want to do this now. And it highlights for me the fact that this patient she is her own agent. She gets to decide what level of risk she's comfortable with or not comfortable with. We discuss the data, what we know, what we don't know, and what we don't know is a lot. And she gets to decide. And, after a conversation, she decided that this is really what she wants to do. And yes, it's, from my point of view, there's a level of risk involved. But I need to be comfortable in that risk as long as I've appropriately communicated and we've had an open and honest discussion about her position and my position and what everybody thinks. But I think this is very similar to the conversation we have with patients with a history of breast cancer, ovarian cancer, endometrial cancer that want to talk about hormones. It ultimately is her decision, and we all need to be comfortable talking about risk.